In this segment, you're going to learn about different types of risks that you have and how to prevent high blood pressure from happening to you or how to take better care of yourself if you already have the condition. We're going to divide them into two categories, changeable and unchangeable. In unchangeable risks, we're going to discuss things such as age, race, family history, gender, and gestational prehypertension. Then we will move on to the next level with changeable factors to show you that you're not doomed just because you have high blood pressure. Some of the changeable factors we are going to discuss are obesity, nutrition and sodium intake, alcohol, exercise, stress, and sleep. Each one of us has been born with certain amount of beats. We don't know how many, we don't know how or when we will go. What we're trying to do here is prolong the beats so that we can be here healthy and happy for a longer period of time. Regardless of where you stand or what your current health level is, it is never too early to start getting healthy. Unchangeable factor number 1 is aging. The clock is ticking, the beats are going, and you need to start taking better care of yourself. Now with aging, it doesn't mean that everybody who gets to a certain age is going to have high blood pressure, but you are at a higher risk. Why? Because we have been living with these organs, including our precious heart, for a very long period of time. And they got a little bit tired. So what we need to do is exercise a little bit more TLC. What does it all mean to you? It means that you're getting older, you need to start putting more care into your routine, you need to start adopting new, healthier habits. Let's do the comparison with the car. Let's say you bought a brand new car. It's new, it looks good, it smells nice, and it runs great. No problems, right? What happens after about 10-15 years? Can you still drive the car? Probably, but you start to hear some noises in the engine and you need to start taking it in for repairs. So, if you want it to last longer, you need to apply some TLC. Same situation with your body. The better self-care you apply, the less chances of getting sick. Hypertension is no longer an old person's condition. In a classroom of 30 youth, 1 has hypertension and 3 have elevated blood pressure. High blood pressure in adolescence is linked to health problems later in life. It is never too early to start making healthier choices. Unchangeable factor number 2 is actually a combination of things such as race, nationality, and environment. It encompasses the way we were brought up, the culture we live in, our society, our environment, the stress we're exposed to, the type of work we do, and even our social interactions. All of that also plays a role in our susceptibility to the disease. The facts are, the African American race has the highest numbers of high blood pressure, followed by the Hispanics or Latino. On a positive note, if you are a part of this race, that doesn't necessarily mean you're going to suffer from the condition, but it is just another heads-up way of telling you to take care of yourself because you are at a higher risk. Unchangeable factor number 3 is family history. Can we change our family? No, just like we can't change our blood or our DNA. Sometimes our DNA is working with us and sometimes it's working against us. If your parents or other close blood relatives have high blood pressure, there is an increased chance that you will get it too. It doesn't mean that you are necessarily going to get it, but it does mean that you need to start adopting healthier habits and you need to really be mindful of everything that you do and everything that you eat. On the other hand, if you have healthy genes, if nobody in your family had these struggles, that doesn't mean here is your ticket to the safety bus. This will never happen to you. You still need to do the safety preventive measures just so you don't start a new family history. It is crucial to take preventive measures. Unchangeable factor number 4 is gender. Now, with the new technology that we have and with the help of surgeries and procedures that can be done, gender change is actually not as uncommon as it used to be in the past. But what statistics are telling us is when you are assigned a gender at birth, That also determines your likelihood of having the heart disease. In general, statistics show that men up to the age of about 65 have higher numbers of high blood pressure than women. Why the difference? The speculations are that men's numbers are higher due to external factors such as stress. Overall, there are more men in the workforce than women. There is more stress involved. However, women's numbers have been dramatically increasing as well, especially over the last couple of decades. Why? Imagine the life of the woman 40 or 50 years ago. What was it like? What did her job look like? What did she do? Most women were back at home, taking care of their children, taking care of the household. Yes, there was stress, but it was different type of stress. Also, in the last few decades, we have seen an increase in divorces, which adds more stress. Now we see more single mothers, we see more working mothers, we see a higher number of one-parent families. All of this is more stress, which affects the likelihood of a woman having higher blood pressure. Overall, men are still in the lead, but women's numbers are very close. After the age of about 65, generally women have higher numbers, and that is due to a combination of hormonal changes they go through, including menopause. In further segments, we will also discuss ways to manage stress to help bring those numbers down. Unchangeable factor number 5 is gestational hypertension, which means during pregnancy. So during pregnancy in general, blood pressure is elevated. The woman's heart is beating for 2. There are many hormonal changes involved and a lot of pressure on the body. So this changes the pressure levels in the body. There is a condition known as preeclampsia, which can create additional complications during pregnancy. If you're diagnosed with hypertension during pregnancy, that does not mean that you're doomed for life. In most cases, after the baby is born, the woman's blood pressure levels are going to return back to normal. What that does mean, though, is that she is at a higher risk later in life, especially if there are other contributing factors, such as family history or raised stress levels. This wraps it up for the unchangeable factors. Now let's move on to things that we can actually work with, things that we can change, starting with number 1, which is a big one, obesity and being overweight. Being overweight puts a lot of stress on your body and a lot of pressure on those organs and blood vessels. Statistically, just by losing 5 to 10% of your body weight, you can help lower your blood pressure with a drop of up to 18 points, which is amazing. In the United States, obesity is up 36% and on the rise. Obviously, it is an epidemic, and it's due to a lot of other factors, which is a different topic that we're going to discuss as well. But the point here is, once you start dropping the weight, you will gradually see decreased levels of blood pressure. You will feel better, and you will have more energy. That is not to say that fit people, people who appear to be in a very good physical shape, don't struggle with high blood pressure. There are other factors that could be affecting them. Maybe it runs in their family. Perhaps they have a very stressful lifestyle. So the point is, fit and skinny people aren't necessarily healthy, but it just means if you are overweight and if you have high blood pressure, perhaps it is time to think about making some dietary and lifestyle changes. Changeable factor number 2 is sodium or salt. Sodium is a crucial mineral that our body needs to be able to function, but there is a certain amount that is recommended and a maximum that we really should not exceed. The average American consumes more than 3 times the amount recommended by the American Heart Association. Now, what does salt do in the body, and why do they tell you to limit sodium intake when you have high blood pressure or you're pre-hypertensive? What happens when you consume too much salt? Salt makes you retain more liquid or water. Water retention puts more stress on the organs and blood vessels. When you start reducing that sodium amount, you will see a drop in your blood pressure numbers, and one way to find out how much salt is in a product is by reading the nutrition label. It is very important to understand how to read nutrition labels and how to reduce your sodium intake. We're not saying that you're not going to have salt on the table anymore, but you need to learn where salt hides in the products that you're consuming and to be able to select the best food to improve your health. In future segments, we're going to explore a lot more about sodium and how to read nutrition labels. Changeable factor number 3 is a bit of a touchy subject because it is alcohol. Alcohol has many different effects on the body. For instance, it interferes with blood circulation and nutrient absorption. Consuming 3 or more drinks in one sitting can temporarily raise blood pressure to unhealthy levels. Alcohol disturbs liver function. Too much alcohol consumption can reduce the magnesium levels in the body, leading to elevated blood pressure. We often ask ourselves, how much should I have? Should I limit alcohol from my diet? How much is too much? The answers to all of these questions will differ from a person to person, and the only one who can give you the answer is your physician. Why? Because if you're under the care of a physician, more than likely they're familiar with your numbers and your health condition, and they can better advise you based on test results. The subject of alcohol is different for every person, also because we all have different tolerance to alcohol and different levels of blood pressure. There is also a lot of controversy on certain types of alcohol, such as red wine. There isn't one right or wrong answer, but the general advisory by the American Heart Association is that it is okay for a person of appropriate drinking age to consume 1 drink per day. 1 drink is defined as 1 glass of wine, which is 5 ounces, or 1 bottle of beer of 12 ounces, or 1 shot of hard liquor, which is 1.25 ounces. Again, this is a general rule and may not apply to everyone. For people with certain conditions or people who are taking medications, it is important to discuss alcohol consumption with your physician first. Also, don't forget that alcohol is highly caloric, so if you're trying to lose weight, you might want to limit the cocktails. Changeable factor number 4 is exercise and energy level. When we don't move a whole lot, there isn't a whole lot of blood circulation in our body, which means you are not helping your heart. Exercise is great for many different reasons. It relieves stress, it helps you lose weight, it also helps you get all that extra oxygen into your cells. Exercise increases your energy level. Everything in the universe moves through energy. When you have increased energy level, your stress levels go down, and that furthermore decreases your blood pressure levels. We have another segment on appropriate exercises for high blood pressure and suggestions to increase physical activity. Number 5 is also a touchy subject because the topic is smoking. Just to put things in perspective, it does affect other organs as well, but it also raises your blood pressure. Within the first 5 to 10 puffs of a cigar or a cigarette, you can experience up to 10-point increase in your blood pressure. On the other hand, when you stop smoking, your body starts to do repairs. So within the first 24 hours of not smoking, your blood pressures will go back to normal. Even a few hours after you have smoked, your levels will start dropping. But if you consistently smoke every hour or every couple of hours and you have that routine going, what you are doing is you're consistently increasing the levels, creating a new normal for your body and raising the bar. Soon enough, your body adjusts to the new higher levels and you start to tolerate higher blood pressure without noticing any changes. If you are a smoker and you also have hypertension, one of the fastest ways to begin managing your blood pressure is to quit the habit first. Without applying any other changes, you will notice a significant drop in your levels. Our number 6 changeable factor is another epidemic, and that is stress. Stress can directly affect your blood pressure. There are healthy levels of stress. It is the good stress, or what psychologists refer to eustress. It is the feeling of excitement and anticipation. That is the type of stress that we experience when we prepare for an exciting event in our lives. Our adrenaline levels are raised, our pulse quickens, but there is no real fear factor during the eustress. However, the most common type of stress that we usually talk about and experience is the bad stress, which can be detrimental to your health. There is no getting rid of the stress, but the most important piece here is to learn how to manage your stress levels. We have dedicated a segment specifically on managing stress to help you get control of it and maintain your blood pressure levels healthy. These are some of the most important changeable factors. We will explore some of them in more detail to ensure that you are empowered with the knowledge and understanding to help you change the course of the disease.